HSJ held a summit on delivering the 10-year health plan, because clearly this is the strategy for the NHS for the next few years at least. Perhaps might not go the full 10 years, but it's an important strategy setting out the way forward for health and care leaders. But the big gap in the plan is about how to deliver it. The message from the centre that we've heard is that delivery is down to local leaders to determine, that they're not going to set out a detailed delivery plan at this stage. So we wanted to bring people together to think about how they are going to deliver it in each of their local areas.
It's about the strategic content of this summit, the audience. Everyone's very excited to see what's next. And so being able to have more of an intimate group of people come together to focus on strategic issues. A lot of speakers, a lot of content, a lot of discussion and interaction. So we're just really excited to be sharing the opportunity and being able to have those conversations.
I think there's a huge amount for people to take away. Sometimes a reminder about what it is that we have done so far since the launch of the 10-year plan, to actually what we can do as a broader community without waiting for further instructions or mandates. I'm certainly leaving with a real energy and momentum to go harder and faster and see what else we can do.
The biggest challenge with the 10-year plan in our space is around collaboration. Trusts and hospitals typically will sit on their own, looking at their own data, and they're not talking to their neighbours. But through data, we're now enabling conversations. So just last week, we were with a number of ICSs looking at some of the variation that we were spotting, and it was just enabling a conversation that they admitted would never have happened if it wasn't for data.
So we've got to really make sure that the patient voice is active. We've got a 10-year health plan that talks about patient power and patient partnership, but we know that we have a habit of system of going off and doing things without really bringing the patient voice in. I'm going to be at all of these things to remind them what we've promised.
We had a really interesting roundtable about neighbourhood health through the lens of dementia. A lot of systems aren't waiting for permission around this. People are just cracking on and making the changes, which is really exciting. People were keen to hear good practice from others, and the need for greater integration is so evident. And so there was a huge amount of enthusiasm for how that would be done, and people brought some really interesting and innovative ideas.
We partner with HSJ events because we feel that they're really well structured. The content and the speakers are absolutely brilliant. Because we've been doing it for quite a while now, we know the staff and everybody's really supportive, and we just find it a really positive and valuable experience.
Whatever part of the system we're in, every single person that's spoken on one of these panels has been very patient-centred. There's loads we all have in common, and for me that's the biggest takeaway. It makes me feel quite optimistic about the future.
We're kind of not afraid to ask the difficult questions. Alistair and Dave has posed some really quite pertinent questions that a lot of people in the room went, that's the question I wanted to ask.
Looking at the people that are in the audience today and having a coffee and having a chat, you can really see the people that attend are those that can make a difference within their organisations, which is actually really nice to see.
There's been a variety of people here from many different organisations, so it's the best place to come if we want to actually get access to those people.
Right now, during these times of change, it's so important for us to help all of our customers to understand where to go. HSJ gives us that compass that helps us with the direction of travel.